started having trouble in swallowing back in about 2003 or 2004, and finally got to the point where I got something stuck and I had to do something about it, and had my throat stretched. I forget what that's called. Off and on for did that once. I believe it lasted for about a year, and then I had a problem again. And so then they finally did some checking and found out I had thyroid cancer, and I had that removed. And then by 2007, I had done some alternate therapy, and supposedly I was cancer-free, but I was still having a problem with my esophagus in that the muscles did not relax. One of them didn't relax properly, and they would tighten up, and I couldn't swallow. Okay. I was diagnosed with thyroid cancer in 2005 and had an operation. 2007, I was considered cancer-free. 2009, where I had that other problem with my esophagus not releasing properly, they found I had spots in my lungs, multiple spots in my lungs, and they wouldn't do the operation. And since then, I've been working on this, and then I found out that my esophagus completely plugged, and by the time they were getting ready to operate on that to mechanically open it, I had cancer in there, and at that point that was inoperable, and they gave me either a chance of doing some chemotherapy or radiation, which I wasn't crazy about, and I heard about Dr.Nezami, and I came down here, and I've been doing his treatment now for about a couple of months, and I felt pretty good through all this time actually, but up until about 3 or 4 weeks ago, when I really, during this treatment, I really got into really weak, and about 2 weeks ago, I started to come back out of it, and I feel stronger and better now than I did before, and I'm including in this the fact that I'm doing some other alternate stuff as well that seems to, I feel, have benefit. So I feel I'm on my way to becoming, I don't know if healed is the proper word, but at least becoming active, livable again, and hopefully I can get my esophagus fixed. I am eating through a tube in my stomach at the present time, which I can say is, the best thing about it is that nothing, it goes from 0 to worse, but I am getting better.
That's good. Mr. Hyde actually came here when he was already struggling with the very advanced thyroid cancer, metastasized to his lungs in many nodules, as well as multiple metastases in the other areas, including the esophagus, which was pretty big in the size. It was about a 5-centimeter tumor that is still there. We do not have an actual recent scan from him to see how much that has shrunk with the current treatment, but we have noticed that since he started the treatment, his quality of life has improved and he has more vitality and function. It's also notable that his natural killer cell activity initially increased more than 3 to 4 times with the treatments. He's not currently receiving any other conventional treatments. He's not on chemotherapy or radiation. He has been suggested to start on radiation, and we also, as part of our standard evaluation, we have done genetic studies on his tumor, and we have found that his tumor is also responsive and susceptible to a targeted therapy that is approved for melanoma. And I have worked very closely with his oncologist, and he has approved my recommendations on using this targeted agent along with current treatment, which includes IV therapies and hyperbaric oxygen that he is receiving on a daily basis, 3 times a week. He has been a good patient for us, and we thank him for continuing treatments here, and it's encouraging to see that he's getting better every day. Thank you.
Okay.